Yes.
And the second question, the second part?
The
second part was there's going to be up to 44 million people that are going to be ineligible for Medicaid under the Paul Ryan funding.
For Medicaid.
And what are we going to do? What are we going to do with these people?
One of the things I think.
Is the state going to pay for it?
Well, one of the things we need to recognize is that healthcare costs are going up, and they're going up appreciably, and we need to. In responding to that, we need to recognize that there are things that we can do on every level, on the federal level, the state level, the local level, and as individuals, to contain healthcare costs. And if we're concerned about increasing healthcare costs, because the higher costs go, there's a limited amount of federal dollars and state dollars and private dollars available for healthcare. So as costs go up, and as the number of individuals in the healthcare system go up, because we're living longer, it's a wonderful thing, it's a great thing. And in our senior years, those healthcare costs get fairly expensive. And so we need to recognize that if there's something we can do to contain healthcare costs, to bring costs down, we need to be doing that. And I'm going to give you a couple of ideas of things that I think we can do to begin to reduce healthcare costs. There have been a number of studies recently that indicate that the number of tests that doctors prescribe or order for our medical conditions, there's an indication that some of those tests are unnecessary. Some of those tests are ordered out of an abundance of caution by a physician who's concerned about a frivolous lawsuit that he or she may be faced with. And the number that I've seen in one of the studies is that as many as 1 in 4 tests ordered by physicians are duplicative or not necessary. 1 in 4 tests not necessary. And physicians that I've spoken to, and I have groups of physicians that I meet with to talk about these issues, as physicians from Pennsylvania and from my district, they have indicated to me that if we enacted reasonable medical liability reform to cut down on the number of frivolous lawsuits or the potential of frivolous litigation, that there would be a reduction in what they call the practice of defensive medicine. They would be able to reduce the number of tests that may be unnecessary otherwise. And so if you begin reducing the number of tests, you begin reducing the costs. And when you begin reducing the costs, you can begin to cover more people for a longer period of time. Don, I'm somebody who believes that we spend a lot of money in healthcare in this country, somewhere between 1/6 and 1/5 of our economy, and those dollars are necessary for our health, and those dollars must be well spent. We have to spend them as efficiently as we can, because there are limited resources and a lot of needs. And I believe if we took all the dollars that we spend in this country in healthcare and we put it all together into one pot and we divided it by 300 million people in this country, we took all the money that we spend in healthcare and we divided by $300 million, I believe there are sufficient dollars being spent today to cover all Americans. We just spend and allocate those dollars very inefficiently. And the duplication of tests in the practice of defensive medicine is one example. And so what I would do is I would get after that inefficiency in the healthcare economy to begin reducing costs, containing costs, to cover more people and to cover them longer. That's just one example. I will tell you, Don, that individuals who have no insurance, that's an unacceptable condition. And we have to work, Don, we have to work together. We have to work together to find not a Democrat solution or Republican solution. Find an American solution to cover everybody. And everybody would be covered either under a private health insurance plan, a Medicare, Medicaid, or VA health care benefit plan, or in the many clinics that we have in the 8th Congressional District. We have clinics in Quakertown, free clinics that individuals who don't have the benefit of insurance can go, can get primary physical care, can be seen by a doctor, can can obtain prescription medication for free, so that they're somebody who otherwise the only way they would get primary health care is to go to the emergency room, which is the most inefficient place to provide that care. That they would be able to walk into a free clinic almost anywhere in Bucks County. We have them in Ben Salem. Doylestown Hospital has the Doylestown Free Clinic. Bucks County Health Improvement Project has a clinic in Quakertown. And so what I would do is I would begin to drive additional federal dollars into those clinics to make sure that until we have a situation where everybody has their own private coverage, that everybody has care.
Don't you think it's a priority of health care?
Excuse me. Let some other people get involved here. The last lady on the left, please, and that'll be our last question.
I have a question. When you were running for re-election back in 2010, you quoted Thomas Jefferson by saying, "A wise and good government will not take from the mouth of labor the bread that it has earned. That is the sum of government." This was back on April 17th in 2010, when you used to go to the Independence Tea Party rally in Philadelphia. I would like to know, my basic thoughts are that the Ryan budget blows up our deficit by $4 trillion. And then you try to get some of it back by making cuts to Medicare and Medicaid and so forth. I don't see this, and I know a large number of individuals don't see this as a prudent way of going about it, and also is not deemed fiscally responsible for our seniors. And I'm one of those seniors. So I would appreciate if you could explain this to us, and to me, and all of us here. Thank you.
The most significant cut to Medicare came as part of President Obama's Affordable Care Act, which reduced Medicare spending by $550 billion, more than $500 billion. Please, let me. I've listened to your question, and one of the efforts that I've made in the United States Congress to strengthen Medicare is to repeal Obamacare and return those dollars to the Medicare program. Now, as I said to Don earlier today, I believe we spend, between 1/6 and 1/3 of the economy, we spend a lot of money in this country on healthcare, part of the healthcare economy. We need to make certain that we're spending those dollars as efficiently as we can. And so, number one, I would say to strengthen Medicare. And by the way, my goal in everything I do in the United States Congress is to guarantee that Medicare will be there for you, for your entire life, to strengthen that system, and also to see that there's a Medicare system for your children and your grandchildren. Okay, so my goal is to strengthen. My goal is My goal is to strengthen and secure Medicare. Number one, in the repeal of President Obama's Affordable Care Act, in the repeal of Obamacare, return that $500 billion back to Medicare immediately. Number two, begin to enact the kind of reforms that will contain costs and make the healthcare system more efficient, more effective, and more affordable by reducing the practice of defensive medicine and injecting the kind of competition I spoke about in the very beginning when I talked about competition in the provision of professional services in Bucks County, which actually reduce the cost to the taxpayer. Competition, we believe competition reduces costs. To encourage competition in the healthcare economy, because competition is a good thing. I figure, man, with respect to healthcare, it's your life, it's your health. It ought to be your choice as to what physician you go to, what hospital you go to, where you receive your care, and how that is paid for. And that's what I want for you. So I'm going to just sum up by saying my goal is to strengthen Medicare, to continue Medicare, to guarantee that there's a Medicare system in place for your children and your grandchildren, to reduce health care costs and make sure that there are sufficient resources for all.
I understand what you're saying, Congressman, but my one thought about this whole thing is everything has to do with everything. All parts of that encompass the Ryan budget and so forth and so on giving tax cuts to millionaires, and another $250,000 a year tax cuts to the top 1% and everything. This is all part of the Ryan budget. It's not just what you propose or what anybody sees doing for Medicare. What needs to happen is we need to take everything together as a whole.
Excuse me.
You can tell us about this after he leaves. Mike does have to leave. I thank you for coming. And Stacy said she's going to leave without you. Here, Mike.
On behalf of the chapter, thank you very much. And on behalf of driver safety, be careful.
Okay, thank you.
Be careful.